Alright, I think I'm recording now. Not sure. We'll find out, won't we? Okay. My name is Laura, or Lola as they call me. And I am starting a new page here, guys. This is MPN. Yes, what is that big, what do those stand for? MPN. Myeloproliferative neoplasms, okay? Yeah, big words, right? Okay, so, myelo, that is bone marrow. Okay, let me introduce you to my friend here. So, I am also a nurse, by the way, and I have an MPN. For you guys that don't know, and I have an MPN, was diagnosed about a year ago. So, myelo, bone marrow. And if you guys, you'll figure, we'll talk more about this. But yeah, hang on, let me figure out where this camera is here. This way. Bone marrow, inside the bone, okay? Alright, we'll figure this out here. In the bone. And if you have an MPN, you know that in this leg bone right here, Mr. Bones here, y'all probably got some leg pain, okay, if you got an MPN. Alright. We're going to discuss some MPNs, and we're going to discuss some other problems. Okay, so myelo, that's the first part of that big fat word, right? Proliferative. Grows really, really rapidly. Okay? Neoplasm. Cells. Okay? And in that cells, okay, how about a red blood cell? Ain't it cute? Oh, here, this way. I gotta go this way with it. Okay, this is a red blood cell. Let's see here. Here, this little guy here. This is a white blood cell. Oh, I keep going the wrong way with this. This is a little white blood cell. Where's my platelet at? Oh, here. Alright, and here's a platelet. Okay. So these three things grow really, really rapidly in our bone marrow, and that's our problem. Okay? So, yeah, it's kind of a nasty little disease. They call it a disorder. However, there's some controversy about that, okay? Myeloproliferative neoplasm disorder. However, when you go and you ask the experts in this, which there are very few, by the way. This is why I started this page, by the way. And don't mind the Hot Mess Express behind me, because I also do a ton of crafts, and yeah, well, whatever. There are very few experts on this topic. And I'm finding out that none of us, we all have a hard time finding someone that can help us. And when we go on, Facebook and YouTube and all these things, we're having a hard time finding people to help us and finding the right treatments, the right medications, what testing do we have done and why do we have it done, and this doctor's telling this person this and this doctor's telling this person that, and we're all very confused. And truthfully, there's no one treatment that works best. It's like anything. So I'm like, okay, we all got to come, have a come to Jesus meeting here. We all have to come together, figure out what the heck is going on. Okay? Because it's a hot mess express right now. Some of us are a total train wreck, and we need to figure out what's going on. So this disorder, a lot of them are calling it a disorder. But the experts are calling it a cancer. Okay, so what is it? Nobody seems to really can tell us. Some people are treating it for cancer. Some people are not. Some people are refusing to take the medicine because nobody can tell us what it is. So, What do we do? So that's why I started this page. We're going to try to troubleshoot it. We're going to try to help each other out. We're going to try to... Oh my goodness, the glasses are probably blinding y'all. So I have a YouTube page that I'm going to start. Thrive when life throws you lemons. I have an MPN Facebook page. And I'll link it in the bottom down here somewhere. I'm not real techie, so if it's not there and it doesn't work, please just message me and I'll figure it out, or I'll find somebody to help me. I'm not real techie with that, okay? But that's what this page is going to be for. We are going to discuss those type of things. So I am a nurse. I've done open heart. I've done dialysis. I've done ICC, wounds. I've done cardiac. Okay, so I've done a lot of different things. I've done travel nursing, things like that. If I don't know, I will find out. I will not lie to you. If I don't know, I will not tell you. But we're going to discuss lab results, why they're important, and this is not just going to be about MPNs, myeloproliferative neoplasms. It's about chronic disease as well. So when we go over lab results, things like that, and chronic pain and things like that, wounds, okay, because we have wounds with this disease, things like that. This will benefit a lot of people in their chronic diseases, okay? We're going to do some exercises. I'm going to take you into my... Oh, you're going to find out I'm not a great housekeeper. So we're going to go into my living room. We're going to do some exercises to help. We're not going to be doing any heavy lifting or anything like that. These are going to be some stretches and some small exercises. We need to keep up our muscles. Okay. Some of us have a hard time getting out of bed in the morning. So some of these exercises will be done in the bed even before we get out of bed. We have chronic fatigue. Some of us can sleep. I can sleep 20 hours a day. Okay, some days I can't even get out of bed. It's stuff like that. Okay, so we're going to do some of that. We're going to discuss all the lab results and why they're important, and why we should have them done, how often probably we should have them done, and when they should be concerning. How about some of the other test results we should have done, diagnostics, like CT scans. How about bone marrow biopsies or genetic testing and things of those, how about taking care of any wounds that we have or itching? How about chronic pain? How about that lovely bone pain that we have that we can't get rid of? Okay, and what works for one person isn't going to work for the next. So if something works for you, mention it. Maybe it'll work for you, but it's not going to work for me. And we'll kind of troubleshoot with each other, because maybe a device will work for you and it's not going to work for somebody else. And I will be discussing that, because maybe you're a caregiver, and I'll show you guys devices that will help you. Maybe you can't bend over and you can't dress yourself. I may have a device that will work for you. Lord love a duck, something fell down. I don't know what that was. Anyways, so maybe I'll find a device that will help you with some of your daily living things that will give you a little bit more independence. It's stuff like that. I'm going to do whatever I can to make everyone as independent as they can, okay? So that's the kind of stuff we're going to help with, okay? Same thing with medications. We're going to discuss medications. Some medications can't be taken together, and people don't know that. Some medications should be taken together, and people don't know that either. Or how about foods? Did you know that we shouldn't be taking certain types of foods? If you have certain diseases, you should not be taking certain kinds of foods. So we're going to discuss that as well. I am 100% guilty of this, and my husband's going to yell at me, and I guarantee it'll be in the comments. Hydration, hydration, hydration. I am not someone who loves water. I hate it. It's disgusting. Ugh. However, we're supposed to be drinking a lot of water if you have an MPN. I do not like water. I'm guilty of it myself because, well, yeah, I just don't. But that's one of the things we're supposed to be doing is staying very hydrated. So we'll be discussing that kind of stuff. But yeah, so let's get into the types of an MPN and kind of what they are, okay? So one of the weird things, I don't know if you guys know this, so let's go over in the bone marrow. I introduced you guys to Mr. Bones, okay? Here, let's show you Mr. Bones here. I don't know if you guys know this. So inside your bones, especially the long bones in your legs, this is where your red blood cells, your white blood cells, and your platelets are mostly made. A lot of people don't know that. If your bones are kind of hollow and spongy inside, okay? And if they were solid, we would be very, very heavy. They'd be very dense, and we wouldn't be able to move around, believe it or not, okay? And inside there, we have a weird mutation. An MPN is acquired, which means something in our genes just went awry, and it just happened. We didn't do anything. We didn't eat fatty foods. We didn't smoke our way into a cancer or something, okay? It just happened. It was acquired. Our parents didn't give it to us. They don't know what happened. A weird gene happened, gave us something. Well, at least with essential thrombocytopenia, the ET version. And it decided to give us something that created too many platelets or white blood cells, red blood cells, something. And it causes blood clots in the blood. And it could cause a stroke, it could cause heart attacks. Could cause clotting in the legs, all different kinds of things, strokes, all kinds of things. So it could be very, very dangerous. Okay, so one of the things is with essential thrombocytopenia, ET, your body makes too many platelets. So with essential thrombocytopenia, a platelet, hang on, let's see what my computer's doing here, something weird. Okay, with too many platelets, a platelet, when you get a cut, a platelet stacks on top of each other to help block and stop that clot. It makes a clot on top to help you stop bleeding. Okay? So if that's inside your body, outside your body, no matter what. Well, that is what I have. And I realized that I had a very large clot in a very fast-moving artery. Okay? And what happened is that I had part of the clot broke off and showered my spleen full of little baby clots. And I got very, very ill one day at work and ended up in the emergency room. Where is my... Looking for my... Oh, here he is. My man. Okay. So, your spleen... Let me see here. Where is he at here? Your spleen... Oh, this way. Your spleen... Oh, hang on. Let me fold his head down here a little bit here. Okay. This way. More this way. There you go. Okay. So your spleen... Where's he at? Here. Right there. does a lot of things for you. It's like a filter, okay? Well, when it absorbs those clots, your spleen becomes way enlarged. Okay, you can live without a spleen. However, one, being a nurse, I didn't want to live without a spleen. Does a lot of things to keep you safe from infection and things like that. It's just not the best thing to live without it. Does a lot for you. So I really didn't want to do that, and it's a scary thing. But if it bursts, it's dangerous. Okay, so yeah, it became very painful. I was vomiting, all kinds. I had no idea what was going on with me. It was very scary. Okay, but this little guy right here, where is he at? Here's this little platelet man. Okay, this way. This little platelet man right here had too many of these. My count was, I believe at the time, it was about 800 or 900,000. Okay, it should be about under 450,000. At one point, I believe it was 1.2 million at one point. But yeah, these help you stop bleeding. Okay, if your platelet count is way low, you have a bleeding disorder and you tend to bleed a lot. Okay. But that's essential thrombocytopenia. This has, when you get your blood test results back, they looked and they saw that I have a JAK2 mutation. And that's what they'll be looking for when you have that one. Okay. When you have something called polycythemia vera, or PV, that one tends to have run in families more, and mostly be male. And that one tends to be red blood cells. You have too many red blood cells. And that also does thicken the blood as well. And sometimes you also have too many platelets as well. And that one, they can sometimes control a little bit with, they tend to check your blood levels and things, and they tend to do therapeutic phlebotomy. They'll tend to take out a little bit of blood every month or every 2 months or something. They'll tend to check your hemoglobin levels and take out a little bit of blood from you. But that tends to be a little bit more on the family side, believe it or not. Not always, but sometimes, and it's in the more males, and tends to run in families for males. But females get it as well. ET is more female, and they tend to be a little bit more into their 40s, 50s, and 60s. So when PV and ET, when they tend to progress long, inside the bone marrow, it gets fibers that form when it is gone without treatment, is what I'm understanding. Okay, I haven't been able to delve into too much research. There isn't a lot of research into this yet, and I'm just scratching the surface over the past year on it. But when you go without any treatment, or it's been undiagnosed for a long time, they get something called primary fibrosis, and inside your bone marrow it starts to get these like web type thing and fibers, and that is when you do need more of your chemotherapy and things, and your body cannot make blood cells anymore because there's no room in there to do it. It's all kind of webbed, and that becomes very dangerous because now you can't make your blood cells because there's no room in there for it, and that becomes very dangerous for you. Now you're going to need blood, and you're going to need platelets therapy and all of that, because now you can't make them yourselves. Now you don't have that proliferative anymore, and it becomes dangerous for you. So that is where I think that other hematologists and oncologists quite don't understand that you do need some form of treatment when you have the PV and the ET, that you do need some treatment. This is what I'm kind of understanding, is that just because your numbers are slightly high, they believe you don't need any treatment. So they just say, okay, you don't need any treatment, don't worry about it. However, all of a sudden people get those really high numbers, and then they realize, oh, guess what? Now you have the fibrosis and it's too late. And that's what I'm kind of gathering from some of the stories that I'm reading on Facebook and YouTube and other things. So I'm, like I said, I'm just delving into some of these things. So I'm just learning. And it seems to be that some oncologists and some hematologists that do not have the expertise in this disorder, that if they don't know about it and you don't have that expert in a MPN helping them along, that you can kind of not be treated properly. So this is where we have to be our own advocates in it. Okay, so those are 3 types now. You have your essential thrombocytopenia, your polycythemia vera, and then you also have your primary fibrosis, okay? And then you're going to get into your more of your leukemias, okay? And that is where this is your specific type. I want to say them correctly because they're very hard words to say. Let me make sure I say them correctly. Let me pull them up here. Because these are more of your leukemias, and they are part of them, but they're specific in your white blood cells. And I don't want to say them wrong, okay? Hang on one second. Let me pull them up here. I don't want to say them incorrectly. Oh, for heaven's sakes, where did it go? Like I said, I don't want to say them incorrectly. They are your chronic, I just had it pulled up here and it erased itself here. It just erased itself, of course. Where'd it go? Of course, when you need it, you don't have it, right? I don't want to say it because they're really hard. Chronic. Nope. There's 3 of them. So it is. Let's see here. I just had it. And then it erased itself again. Oh my goodness. I'm a hot mess train wreck, y'all. Hang on one second. Alright. I don't want to say the names wrong because I know they're really long. They're really. Where'd it go? It's CEL, CNL, and CML, and I know they are chronic myelongus, or cannot say that word. Chronic eosinophilic leukemia, and chronic it's a neutrophilic leukemia, and then myelongus leukemia. I cannot say that word. I can't say myelonic. Where did it go? I cannot find it now to save my life. There's my spleen one. stores and filters blood cells and helps you fight infection. Okay, so I found that one, but that's not the one that I wanted. That is not the one that I wanted. Totally not the one that I wanted. Oh, there it is, right there. Oh, for heaven's sakes, it's right there in front of my face. Okay. Myelogenous leukemia. See, can't say that word anyway. Okay, hang on. Alright, so eosinophilic leukemia. ECEL. Okay, the white blood cells. So there are 3 types of white blood cells, okay? So eosinophils help you against allergic reactions. So that is one of them. It's very rare. It is an actual type of leukemia. So, but that one is very rare, and we don't see that one in MPNs very much, okay? Neutrophils, that's the one that helps your body fight infection. And that is serious infections. But again, we don't see that type of leukemia very much. That is, these are actual other ones, but I don't think we see that one very often. And then I said the primary fibrosis, that's the one that's, we don't want to get with the PV and the ET. And the other one, CML, myeloid leukemia. That is the bacterial infection. So we want to try to avoid any of those because we need those type of white blood cells in order to help us fight infection. Okay? But again, those are very rare. We don't see those very often. Now, like I said before, what we're going to do with this page is I'm going to start discussing lab test, diagnostic test, why you should have them, when you should have them. We're going to exercise. I'm going to show you guys different types of aids to help you with your daily living. We're going to discuss the experts. We're going to try to find you guys some experts on MPNs because maybe your oncologist and your hematologist, how to talk to them. If you don't feel that maybe some of these tests that they're not doing. Because I'm finding out that my doctor, I found out there's some testing that he should be doing that he's not doing. And I found out a couple of interesting tests that, I should be having and I'm not. And I don't know actually why I should be having those tests. I don't know why. And I'm going to be asking I'm going to see if I can get a couple of experts to see why I should have those tests. Because I don't know why. Like uric acid. Why should I have a uric acid test? I don't have gout. And when I went to an MPN expert and he ran a uric acid test, but I didn't know he ran it until after I got home from Florida. I live in Michigan. And he ran it, and when I got home and I saw the result, I'm like, why did he run that test? I don't have gout. Why did he run it? I don't know. So I'm curious on some of the tests that they run and why they run them. I don't know. But that's one of the things that I'm hoping to answer on this page. So we're going to find out, uric acid is one of those tests that, like I just said, maybe you guys don't know why. You don't know a uric acid test is run for gout. But I'm going to explain that to you, and we'll get into more of that. But that's why I said. So something interesting I want to show you guys. One of the things with an MPN, did you guys know that sickle cell disease is an MPN? You probably didn't know that. That's one of these fun facts. Not a fun fact if you have sickle cell, though. But sickle cell actually has a very interesting history behind it. If you have sickle cell, you actually get it from both parents. both of your parents need to have that sickle cell gene in order for you to get it, okay? But there is a reason that you get sickle cell. Believe it or not, if you have malaria, yours, like now, we don't have malaria here in the United States, okay? But people have sickle cell. But in Africa, you know, many, many, many years ago, if you had malaria and you had sickle cell, you would live. So malaria is a parasite, and it eats red blood cells. So I have made a red blood cell here, okay? A red blood cell, here this way, is concave, okay? And it holds oxygen, and it feeds your body with oxygen, okay? All your muscles and everything, your tissues with oxygen. And let me show you here. Okay, let me see here, this one. Okay, and it is hang on, I made myself a PVC pipe, artery and vein here. And it is, this way, and it is flexible, okay? So it'll go through here if it has to, and it'll go through all these things, and it'll squeeze through, not to scale, y'all, not to scale. And it'll squeeze through if it has to, okay? It'll go through whatever because it's flexible, okay? It'll do whatever it has to do to fit through whatever, flexy bendy. But a malaria will eat this. This is what it eats until its host, you, are dead, okay? However, sickle cell, okay? A sickle cell patient, their red blood cells are hard as a rock. Still carries oxygen. Not efficiently, though. Not much. And it is shaped like a sickle, okay? This way. Okay? Hard. Okay? Not very flexible. Okay? So, as it's going through, it'll go through. Okay? But it gets stuck. Okay? It'll get stuck. This is what gives sickle cell patients their pain. And they have a lot of pain. And they are miserable. Those poor people are miserable. And they've got chronic pain. And I have known 3 sickle cell patients in my career. And I feel for them. They are miserable. And I feel for them. And they need so much pain medicine. And I want to cry for them every time they go through a sickle cell crisis. Okay? And I mean the pain medicine is serious. But years ago, there was a reason for this. They would live because malaria can't eat this. So there was a reason for this years and years and years ago, okay? Because they would live, okay? So Mother Nature had a reason for it, okay? Now there's no reason because we have a cure, okay? So that's just a fact that y'all maybe didn't know. A lot of people don't know that, but Mother Nature has a reason for some of the things that she does. I still have not figured out the reason for poison ivy, though. Haven't figured that one out yet. You know, some things have a reason. Sickle cell, I figured out. Okay, you know, that's, you know. Poison ivy, I haven't figured out. You know, roses have thorns, and things like that. You figured those out, you know, whatever. But poison ivy, I haven't figured that one out yet. There's a book out that says Never Kiss a Billy Goat on the Lips, and it is because billy goats are the only thing that I know that can eat poison ivy without getting sick. So maybe billy goats needed food at one point. I don't know. But yeah, there was a book out called Don't Ever Kiss a Billy Goat on the Lips, because they can eat it without getting sick. So, but there's another fun fact for you. But I will go live again. Okay, and we will discuss, next time we'll discuss some labs. Okay. But if you guys can please, subscribe to my page and like the page, share it with your friends. And we'll get this page up and running. I will try to go live almost every day. And we will see what we can do about making people healthier. Even if you don't have chronic disease and you just want to kind of get up and moving, we're going to do it slow and steady. If you want to be healthier, you want to become more informed about lab results, testing results, why it's important, that would be great too. We may even be doing a little bit of crafting on the page. I'm going to share this amongst all my stuff, so we may do a little bit of that as well. I will be sharing very shortly. I will be having some cause gear, okay? MPN shirts and hats and pins and things like that, and I'll throw in some kidney disease and heart disease and things like that. I'll be designing some of those type of things as well. So I'll be throwing that in there into an Etsy store really shortly. But please like, share, okay, with all of your friends, so that we can get the word out, and let's make some people healthier, okay? Be greatly appreciated, okay? I appreciate all of you, and I hope that we can come together as a group and make everybody's life a lot easier and a lot happier really, really shortly, okay? So let's thrive together, okay? All right? It's great that y'all are with me here, and I cannot wait to see how happy everyone can be together. All right? Thank you so much. All right? We will see you all soon. Thank you.